Hi, everyone. Thank you so much, and happy birthday, Sevly. My question is for Sevly and Lorraine. You hinted at this a little bit in your talk, but there's just so much energy and momentum around guaranteed income right now, and of course, many of you have seen that there is a lot of press happening right now around a few studies that have had null effects, and I'm just curious, given both the amount of work you guys have done in this space, how you are approaching the media and what's happening at that level, as scientists and advocates. Thanks.
All right. Awesome. Thank you for that question. So I think I was actually quoted in one of the studies by the Open Research. So Sam Altman ran a demonstration that no one really knew about. It was a randomized controlled trial. So we're seeing, a lot of the health effects, and impact are actually being told through the qualitative pieces. Mm-hmm. We're seeing people talk about how it's impacting their well-being, how they're able to reclaim their time, how they're able to spend more time with their children. But a lot of the objective quantitative pieces are more challenging. One thing that we saw in the Sam Altman study, or the Open Research study, is that they also looked at biomarkers for like diabetes and et cetera. So they didn't find any health associations or relationships with that either, but I think what's important is to really think about like the study population, right? If you already have a healthy population, you are not going to see health changes, right? Because they're already healthy. But that's something that we need to be able to contextualize a little bit more, is like understanding the context, right? And the context for the baby first years, for example, is they gave people $330 a month, which is not a lot in New York City and a lot of these cities that they're implementing it in. So we really need to think about the frequency, but also the amount, right? And I think those are some of the questions and the research questions that are emerging from this space. And there's also within the advocacy spaces, because I'm still connected with a lot of the groups that are doing the work on the ground, is that they understand that cash plays an important role, but it's not going to solve every single problem, right? And also, they acknowledge that health takes time, right? We don't see it happen immediately. For the health outcomes that are more shorter, that require less time to see, we're starting to see those benefits, right? Like the mental health, less stress, less psychological distress. But I do think with a lot of the emerging evidence that is coming out, we need to be critical of like who is being studied, what is the amount, how are they studying the health effects, and I do think we do need more public health scholars and epidemiologists and et cetera in those spaces to really talk about how do we capture that. And I know that we are trying to imagine that right now with the Baltimore study of like how could we link administrative data to follow people for a longer time.
Thank you. This is a great panel. I think one theme that I think is really important here, and that I think came out in all of your talks, is the challenges of evaluating these interventions, of course. And I think it really has to do, as Theme was saying at the end, it has to do with the fact that that we're working within systems, and it's not. And it's very naive to transfer, the traditional randomized clinical trial paradigm into the setting and expect it to work. It's incredibly naive. And yet I think, and unfortunately today with what's happening also in terms of science and specifically at NIH, but in other places, this shift towards this very practical, well, let's figure out what works immediately kind of thing, which is not the way this works, right? Because it's multi-pronged intervention. It's over long periods. It's dependent on context. There's so many, and so I think you're all grappling with this in different ways. And I'd be interested in any reflections you have on how we can support that thinking better and get the word out about it, that this is the way to do gold standard science, if I can appropriate that term, is to do the kinds of things that you're doing, not necessarily to do the naive, well, let's do this and expect an effect on life expectancy in 6 months. It's really not scientific. So I don't know any reflections you have on how you're kind of grappling with that.
Do you guys want? Oh, yeah. I think, honestly, our thinking was shaped by some of the stuff you wrote about systems and complex systems. So I don't want to. I'm going to parrot back what you've said. No, with attribution. I think, so it's funny, over the course of Ignite, I went from this like RCT economist to, it's messy, right, to do an RCT in this type of environment. Like we are succeeding in some ways, and in other ways, like what I thought was not succeeding was actually just reality. I think you mentioned that, or you mentioned that with Flint. And one of the things I think that I've learned is people ask, can we transport this to Baltimore, Detroit? And I was trying to read the science of it, and I think the answer is no. And there's two reasons. One is we haven't invested in a model of like how a given intervention works, the heterogeneous treatment effect of a given intervention conditional on other characteristics. So you could have a bunch of studies on guaranteed income. It'll work for some people, not for others. It'll work in some places, not others. And it all has to do with the context. And we just haven't bothered to do the work to measure it. But if there's a way to show and say like, hey, this works for people if these other things are true, and like really have that, like a viral graphic version of that and a theoretical backing to support it, I feel like we could go a lot farther. So one of the things we're trying to do, which isn't going to pique much interest among people who want a soundbite, is we're trying to get into Bayesian heterogeneous treatment effect type models and really like BART and try to really understand who's benefiting, who's not, and what can we learn about kind of the milieu they're in that sort of makes these work versus not work. So that's a partial answer, but.
Yeah. And I can comment on that. It's very messy, and doing these evaluations is very difficult, and it's also very expensive. But we also need to understand the needs of the stakeholders and our policymakers. So what we're doing right now, for instance, in the Solar Bulk Climate Project, is to continue doing these evaluations, but also having these simulations, that more informed simulations, long-term, that can provide some input to our policymakers. And at the same time, since we're using the best data that we could do, we are building the baseline for the future evaluations. And I think that helps us to first provide some information to our stakeholders and policymakers, and in the long term, probably having the baseline for a better evaluation. But we need to be conscious that our policymakers need things within a 4-year period. And if we want to work with them and provide data, we also have to be willing to do something imperfect, but at least informed.
There's a local Philadelphia comedian that has this joke about losing weight, and he says, he's like, I didn't eat anything yesterday, and I stepped on the scale this morning. I haven't lost a pound, right? So I think in health, we do understand, right, that we need to wait longer term and have, I would say, sustained interventions, sustained influences. But I think to your point, I mean, in the case of guaranteed income, a lot of those pilots, and the reason we don't have a lot of great health data, those pilots were actually championed by mayors. They were not thinking about the health impacts, right? It was not designed to do that. And they're looking at, what am I going to be able to say in my stump speech 2 years from now when I need to get reelected? So I actually think we have to be a little bit savvier about, okay, what are the things that we can give them in the interim, because, that they're going to need to say, but then also talk with them about legacy. Say, there are some things, there's these interim findings that we'll be able to tell you, so that you'll be able to say this before you get reelected. But if you also want to have a personal legacy, here's what's going to happen in 5 to 10 years, and we can forecast that. And just tell people up front, don't expect it either. But there might be other value that they see in kind of doing something that has longer term investments.
This is a question for Dr. Sarmiento. In your slide showing your experimental design, you showed a component that had simultaneous bidirectional exchange of information between quantitative and qualitative. And I'm assuming the qualitative was surrounding the community engagement and citizen science you were doing. I was wondering if you could tell us how you achieved that in practice, because that's a very impressive level of co-design and research. So I'd like to hear more about it.
First, it's difficult, but it can be done. But the way we did it, we have the qualitative team doing the citizen science at the same time that we were collecting the survey data. And then when we were analyzing the data from the qualitative and the quantitative component, we tried to do that in a convergent way, which means at the same time and providing the same weight. And understanding that both methods provide different inputs. It's not that this one is more important than this one, but it's how some of the constructs that emerge from the qualitative could be convergent, divergent, or complementary to what we were saying. But the way to do that has to be done, the data collection has to be done simultaneously. Different sample size, of course, but simultaneously. And provides some, which is like what you did, some quotes that are so important for our policymakers. And those quotes and those stories matter for advocacy of those projects.
Hi, thank you all for your presentations. They're all really interesting. I was wondering if you, I think across the group, there was different ways that y'all engage with communities and had participatory elements in your projects, and I was wondering if you could maybe reflect a little bit about the ways that you approach these communities, knowing that a lot of times policies are enacted without their input, and there might be a lot of historic mistrust for good reason of people who are coming in and saying, oh, we're going to do this project for you. Yeah, if you could just speak to the way that you approached and worked with communities.
I can kick us off. So U of M has had 20 years of experience working in Flint and so I came a little bit later than that, but one of the things that we've always said to our partners is that you guys lead, you guys tell us what you need, and we can nerd out with the numbers. Mm-hmm. And I think that's deeply rooted in the principle of the people closest to the problem are also closest to the solution, right? And so if we are able to have that opportunity to go to the community and say, hey, there's this potential for this grant for us to apply, what can we do? And they will lay out. And so, for example, the legal dumping project was as part of this youth violence prevention program that at the end, it was all focused on greening. And we constantly heard from community members, our biggest barrier to greening is illegal dumping. Those rocks and those things get caught in our machines, and it costs us so much money to help us clear the land. And so that's where the idea came about. And so it's been really cool to see how one project leads to another, but that does require a lot of time and a lot of trust building. And there are times where there's issues that come about. And so I think transparency and having the opportunity to just communicate, not just around research projects, but also show up as researchers to those communities and be present, I think is really important.
In the guaranteed income work, there were a couple of things. So, I mean, one, just think about if someone told you, put your information onto this website and the government might send you $1,000 a month. You are not doing that. I mean, right, I don't blame anyone for not wanting to do that. So they did a couple of things. One, the mayor's office issued the call, but then they partnered with a respected community-based organization called the Cash Campaign to actually do the disbursement, and then also they were already working with populations with low income, so could kind of funnel a lot of the work through there. So essentially leverage the trust of other trusted organizations. We also kept Hopkins' name out of it. We know that Hopkins has not been a trustworthy institution, so we kind of essentially, unless we had to by our IRB, Hopkins' name did not show up on anything because we wanted to make sure that the institutions that were involved could preserve trust. They also had a structure where they had a steering committee, which included researchers, funders, and others, but then kind of a community committee where when it was time to figure out who should this go to, how much money should it be, and those sorts of things. They essentially did pulse surveys with these small groups of community members to get their input up front to frame how the intervention should look. So I appreciated their approach of involving communities in different ways and at different parts of the process. And then for the Health Consortium, you want to talk about how you worked with community members there?
Yeah, so for the Health Consortium, one of our main objectives was to create opportunities for folks to further see how health is connected to guaranteed income. So we had a bunch of scholars across the country come together, but one thing that we did do was we created community consultants, which were people on the ground implementing the work, participants too, who were in guaranteed income pilots, and we paid them to be at the table with us and tell us, like, how do we make this toolkit accessible to folks that y'all are working with, to the decision makers you'll be working with, and et cetera. But one thing that we did learn was that they didn't just want a way of how to study guaranteed income, which is what the part one of the toolkit was focused on. They were like, we need another piece that allows us to help translate this evidence to decision makers. So our community consultants actually like pushed us to create a part two of it, which will be coming out maybe in the next month or so, maybe 2 months, which really thinks about how can they talk about the findings, how can they contextualize the health effects in order to translate pilots to policy. So we did bring people who have the experience to the table, and we paid for them. And I asked our funders, like, we need to pay community consultants, and we need to pay them like $200 an hour, and you can't fight me on that. So let's invest in X amount of spots. So, and we were able to do that.
Yeah, I was going to say, so in Colombia, we're working in informal settlements, the most violent areas. We have to work with the community, build trust, not with the police. That's the rule number one, is just try to build the trust within the community, understand the different neighborhoods. As Anna said, it's not like you can really select randomly all the neighborhoods. There were neighborhoods and blocks where we couldn't get in because of drug trafficking and violence. But the main thing was working with the community and getting the trust. As you said, it takes time. It's not gonna happen in a month or in two, it's gonna happen in more time. And the other thing that is important, they are tired of researchers to go in there, do the research and then leave. So if you don't co-create with them, even now that that part of the evaluation is done, we are actually going there, providing the information of the evaluation. We're actually going to have an exposition in the museum with all the things that happen. So also be aware that we cannot be like helicopters going there, picking up all the information and just leave. So I think building trust, but continue with that after the funding is over and after the project is over, is something that we need to do if we want to continue working with the communities.
Just very quickly, if that's okay. The Center for Health Justice, I can see some of the folks right there. I didn't see you, Abby, earlier, but hi. And the Urban Health Lab have been working in these communities for a decade, so we were able to leverage that. The interventions were delivered by community partners who are known to members of the community, so it was kind of distancing Penn from the community, which is, we have the similarly fraught relationship. And then we hired people from the communities to basically deliver the intervention in the treatment areas and do the surveys. And so that also helped too, and there was a lot of kind of communication between that. Altogether, like, we weren't surprised when we saw that the crime drop that happened in a standard econometric event study happened kind of immediately as we entered the cluster. Partly because we were building expectations, but because it was just it was just like a respectful natural partnership, and I think that was some of the treatment effect. And how do you replicate that elsewhere, right? Like, how do you transport that? But really a lot of credit to you guys for having these relationships and being so intentional about bringing, just being respectful partners.
Question in the back, yes?
Yes, thank you so much. I'm Marie O'Neill from the University of Michigan. I really enjoyed the panel. I wanted to follow on to something that Olga Lucia mentioned about simulations, and also thinking about that beautiful picture of the baby celebrating 1 year. The idea of working with community members to envision the future that is better, maybe a map where we don't see these dark blue or dark red spots always in the same community. And I'm thinking also, I've seen, not Roshanak, but another member of the team at Michigan show images of what does a greened vacant lot that was formerly full of trash, look like. And so I guess I wondered if some of the members of the panel could talk about whether they have done any of that kind of work of envisioning a future. What would you like to see as an outcome of an intervention? And maybe getting a little bit to Anna's point that sometimes these outcomes may be decades into the future. It may take a while for the outcome, and maybe the intervention has to be sustained in a way that can envision that outcome. So just maybe comment on, the use of images or pictures, or even hearing from community members of what would they like to see down the road as a way to kind of guide the research or the intervention.
So our project was funded by the Robert Wood Johnson Foundation. It had a number of different components, and one of them, I don't know if you want to talk about the End Poverty. We had this End Poverty canvassing campaign where we went to community festivals in Baltimore, and we literally asked people, like, what would it look like for poverty to be gone in Baltimore? Literally, what would that look like? And you want to talk more about, you were more involved in that?
So it was fun. I went to the African American Music Festival, AFRAM. It's like pretty big in Baltimore. They actually have lots of great community events. And it was fun because I remember Ty Dolla $ign was there that day. So I was dancing with people too in the community. But we were there sitting and trying to have more discussions on like, how do we imagine a Baltimore where people have where poverty was abolished, right? When we could end poverty, and people were thinking more about, and we asked everyone who would walk up. We had little power banks, like little knickknacks for folks, but it was really exciting to hear that people know that like it is possible, for us to imagine a world where people have their needs met. It is possible for their elders to have food, to have access to transportation, that their young people have places to go. So we really had the opportunity to kind of just be within community, and people do think and imagine and dream of these things. And we wanted to create a vision and a plan of what that could look like if we were to translate that into policy. So we really took the ideas of community and we talked about, here's what other places are doing. Like, is this, should there be like living wage? Should there be universal childcare, things like that? So we're having conversations with them about like what was important within like their community spaces, and also trying to have them think about like, here's what people are proposing, right? Does this even make sense in Baltimore? And we were trying to actually go into churches and spaces where we know that churches are a big institution within Black communities. So we wanted to go into those spaces. We didn't get to that point because of funding challenges, but we did try our best to meet community where they're at, and share space with them, and really have conversations about what is important to them and how could they imagine something better for their communities. And I think that's was the beautiful part of like some of the work as a researcher, because we imagine equal worlds a lot, even in our analysis when we like adjust for things, right? So I'm like, I can imagine what community here that's not really a community that I come from, but I can empathize with because I understand struggle, and what freedom and liberation can look like. So that was a joy to be able to talk to people.
And then we shared that information back with the Baltimore Mayor's office so they could see the type of policies that people were championing.
Oh.
And in terms of simulation that you were going to say, so for instance, for the green corridors that we are evaluating, we know that trees takes a lot of time to build, or for the electrification of the fleet. So we're using those response relationships between exposure to air pollution and prevented mortality. Some hospitalization, most of the data is for adults, 30 or more. And by using those response rates and having data at a smaller scale of our interventions, we are simulating what could happen in the future if we built this amount of greenery, or what would happen in the city if we have this electrification of the fleet and we combine that with emissions. So again, you need good data, or relatively good data for those simulations, but at the same time, we're using the narratives that you were telling us. So for us, our population is how do you imagine this green corridor, or what would be the positive things? So you, with our experts on qualitative data, and actually with journalists at the same time, we create stories. And with the personal devices on air pollution, we create stories of how do you imagine these areas. So I think many of the tools that we need to use right now need to be mixed tools if we want to have a policy impact.
One here,
Uh,
and then.
I'll be really quick. I also encourage all of you to consider, when you're writing grants and such, to include peer networks. Having teams like from across the country getting to go to another city and seeing it. I know it's not one solution fits all, but we've had community partners go down to St. Louis and see some of the work that's being done on vacant land, and even take that information and come back and be like, okay, we can't do it exactly this way, but we can adapt it and do it this way. And that ability to have those networks to have those conversations has been really powerful too.
One thing I was going to say is there's two statistical approaches that might be useful if the situation presents itself. One is there's this really, I thought this really interesting paper that used quasi-experimental estimates of short-run impacts of pollution on things like cardiovascular disease, and used those estimates, but take a structural model of the relationship between various kind of shocks during the life course and mortality, and they basically fit the parameters of the model using quasi-experimental types of data that we generally generate. And their study is about what is the long-run effect of exposure to air pollution, which is really hard to do causally. But in combining the model and these short-run estimates, which you can do causally, they have these very credible kind of interesting estimates. So to the extent that we can build these models where we're able to, like, a few parameters, have a decent kind of approximation, and then use the data that we have to plug in, I think could be really good. The second thing I've been seeing more of is the use of surrogate outcomes. So you want to convince a policymaker about some long-run effect of a policy, which it's going to take 20 years to measure, but in the next few years, you are going to measure variable, outcome Y1. You're really interested in Y2, but you have data all around us that link Y1 and Y2. So under some assumptions, you can say, hey, this is what I would expect my intervention to do for outcome Y2, and you can take that to a policymaker at the end of the trial. So both combine kind of either some theoretical approach or observational data with just the types of estimates that we're really good at generating in the short run to kind of fill the demand for sort of the long run estimates.
Well, unfortunately, we're run out of time, but this was amazing. Thank you very, very much, all the panelists. Thank you all.